And we thank everyone for joining us this afternoon for our COVID-19 vaccination panel with our esteemed colleagues from the healthcare industry and our partners at AtlantiCare. My name is Christopher Catching. I'm Vice President for Student Affairs at Stockton University. My primary role here is to support the student experience from the time they get here until the time they graduate. And I work with a number of great colleagues here who do a lot of work in the trenches to do just that. We're going to be having a really important and timely discussion about the COVID-19 vaccination. And I have a panel of esteemed colleagues here that I'm gonna allow to introduce themselves to the audience before we get into our conversation. And I will start from my viewing screen and just point folks out to introduce themselves. So Dr. Shine.
Good afternoon, everyone. I'm Dr. Zupenda Davis Shine. I am the Director of Health Education for the Burlington County Health Department. And I guess over the last 18 months, my primary responsibility has been disseminating prevention messages as it relates to COVID and also information regarding COVID testing and now vaccine information and also how to get the vaccine.
Okay.
Thank you.
Yes. Sandy.
Hi, my name is Sandy Festa. I operate various primary care practices throughout Atlanta County.
Okay. Charisse.
Hi, everyone. Thank you so much for inviting us. I'm Charisse Fizer. I am Vice President for Clinical Services at AtlantiCare, as well as the Chief Diversity, Equity, and Inclusion Officer. And I would say in relationship to the vaccine, we have done an excellent job, I think, of getting into the community to try to alleviate the fears associated with the vaccine. And we've gotten a lot of people vaccinated through grassroots efforts.
Okay. Welcome. And Dr. Trivedi.
So my name's Manish Trivedi. I'm the Chief of Infectious Diseases at AtlantiCare and co-chair of Infection Prevention and Control. And basically, our job over the last 18 months or so is really to be taking care of patients, but as well as administering policies within the hospital to keep our community and staff members safe.
Absolutely. And we appreciate you joining. Dr. Trivedi has joined us for a number of our conversations throughout the past year as we've navigated the COVID-19 pandemic. And I want to provide an opportunity for Dr. Trivedi to provide a brief overview on some information about the vaccination itself, and then we'll have a collective conversation about with our group here. So, Dr. Trivedi.
Of course, yeah. So I presented a few PowerPoint slides. If we wanted to get into that, that would be excellent. Essentially, this is an update from COVID-19. When it first started, COVID-19 really was unknown. And as we've kind of learned over the past 18 months or so about the virus, we've started to learn more about different variants. We've learned about different side effects, different pathophysiology of the virus, but as well as the vaccines that we've developed to combat this virus. So just a few opportunities right now, a few moments just to kind of really discuss and break down some of these things. It'll start out a little bit elementary with stuff that may sound redundant, but it all ties into the vaccine at the end. So bear with me. So how do you catch COVID-19? You know, we hear about this oftentimes. When we first started this journey, we were concerned that this was just a respiratory disease, meaning people who exhaled droplets would spread the virus from one person to the next. We also were concerned that this could be from contact, touching surfaces, and then touching your eyes, touching your face. We've now learned a little bit more that it is exhaled. Sometimes it can linger out into the air, something called droplet and something called airborne, where it stays in the air a little longer and is inhaled by another person. But the contact is lesser likely to cause you to have an infection. So touching surfaces that may have been contaminated, and then moving forward may not be as bad as we initially thought, but that's certainly a different method of catching the virus itself. Some of the signs and things that you need to pay attention to is individuals who are sick, obviously, we know, and we'll go through a little bit of the symptoms of if you're ill, what they may seem like, and to be aware of those. But there are people who are unaware that they have an illness. They're asymptomatic carriers. Some of these people can be called super spreaders, where they're unaware and they can project a high viral load to other people. So speaking in large groups in enclosed areas, being unaware that you're infected because you're not really having symptoms or very minimal symptoms at best can cause that to shed. People sometimes who have it, especially in our area in South Jersey, where allergies are very rampant, sometimes confuse their symptoms for allergies themselves. So we need to be aware that they can mimic very similar illnesses like allergies or like the common cold, but to always keep COVID-19 in the back of your mind when moving forward. So what are the signs and symptoms? And I know this sounds a little bit generic, but bear with me. So headaches, sore throats, fatigue, people with new onset of smell, loss of smell and taste. Now that's a really big one, and we'll get back to that. Cough, sneezing, stuffy head, congestion, runny noses, fevers, chills, body aches, diarrhea. That loss of taste, of smell and taste is a very important thing, because that's very unique to this disease. Very few things can cause that. And so if you start to develop that, that's almost a telltale sign that you may have been infected with COVID-19 and to seek additional help. Some people go on to develop further symptoms. These include respiratory distress, shortness of breath, wheezing, sometimes an extreme cough, and high fevers in the 103s, 104s. That also is a sign that we need to be concerned. So it's the same variants, different names, and these are like the new names for the variants that we've heard of perhaps throughout the media and through research and reading about COVID-19. There's several variants throughout the different countries that have been spreading. Since December, we know about the Alpha variant. This was formerly known as the UK variant. It was detected first in Great Britain, but now it's renamed as the Alpha. There is a Beta variant. This was known as the South African variant. Same time in December. This was kind of spotted first in South Africa and then subsequently has spread across the world. The Gamma variant, found in Brazil. This was later found in January through travelers, and they noticed that this was found from screenings in the airport. We have Epsilon, which was first identified again in California, and then Delta, which is the big one that we've heard, the India strain. There's a Delta Plus, which combines a few of these variants together. What we know about the variants is each one has an individual kind of process, but we know that they spread more easily, more quickly than the native COVID-19 or the COVID virus. And so they spread much quicker. They can cause more virulent disease in certain individuals. But the real concern is that it spreads. And because it spreads so quickly, you can potentially increase deaths and hospitalizations if you're come in contact with this. So we've developed vaccines based off of the native COVID-19, and then these variants started to pop up. And our biggest concern was, do these vaccines work against all of these different strands? We know that there are currently 3 vaccines authorized in the United States. Pfizer is a company, Moderna, and Johnson & Johnson. Pfizer and Moderna use very similar technology, something called messenger RNA-based vaccines. J&J is more of a traditional vaccine, something known as the adenovirus vector vaccine delivery. There are other ones that are currently in phase 3 clinical trial, AstraZeneca, and of course, Novavax. Things we do know about these vaccines is that they do not alter your DNA. They don't change any kind of coding in your system at all. Messenger RNA is not does not enter the nucleus, and so it doesn't enter where DNA is stored. We also know that these aren't live vaccines, meaning you're not getting COVID-19 to induce immunity. It doesn't use dead vaccine at all. It actually uses genetic material, and we'll go into more of that further. So how does this work? And I kind of alluded to this. It doesn't enter the nucleus of the cell. So messenger RNAs are very, very unique technology. We've been using this technology for quite some time. I would say probably over 7, 8 years. So it's not something novel. The more novel approach and why people are very intrigued by this is the first time we've used this technology for vaccination purposes. What we did is we used what's called messenger RNA. Messenger RNA is essentially a blueprint, or like exactly a blueprint, and it takes this small piece of information and tells your cells to build off of what information it's asking. And in this case, it's something called a spike protein. If you've ever seen a picture of COVID-19, you'll see that there are all these spikes on a ball. And what this messenger RNA encodes for certain spike proteins on that ball. And it tells your cell to start to develop those spikes. And then once you start developing those spikes, your body recognizes this as foreign, and it starts to develop antibodies against those spikes. That messenger RNA, once it's entered into your cell, doesn't last very long. Those spike protein cells don't last very long in your body as well. Your body eliminates those cells through the natural life of their cell. But what does continue onward is these antibodies that you've created. And that's the important part of how to develop immunity. Viral vector vaccines is very traditional. We use this technology in vaccination purposes throughout multiple different vaccines. Those of you who've gotten the flu shot recognize that the viral vector is similar to that. We use a virus known as an adenovirus. It's a very stable virus. We hollow it out and we infuse it with information that allows our cells to develop these spike proteins as well. So these adenovectors go in, they pseudo-infect your cell and inject that material, which then tells your cells to develop those spike proteins. So without using mRNA per se, it actually takes some of that piece of information and tells your body to develop that. J&J uses that technology now, and it does a wonderful job as far as inciting an immune response. So some of the side effects we get with vaccines in general, and especially with the COVID-19 vaccine. Of course, you get pain, redness sometimes, and swelling at the arm site. Oftentimes you get an injection, you're going to get pain at that site. The redness we've noted, some people develop some redness around the injection site, which dissipates within several days. Several hours later, some people experience tiredness, headache, muscle pains, oftentimes some fevers, chills, maybe nausea. This typically dissipates within 24 to 36 hours, at which point you go back to completely normal. So that's more of an immune response. Your body is revving up during that time, developing these antibodies, and that's where you're starting to feel those chills and fevers. So mention some of this, but in the rare instances that you have some allergy, and we can go into this in a little bit more detail later, but as far as the components of what the vaccines are made of, if you have an allergy to that, you may develop difficulty breathing, some swelling, tachycardia, which is a fast heartbeat. Some people develop the body rash, but again, that's to the components of the vaccine, not necessarily to the vaccine material itself. But similarly, all of the previous things I mentioned, the pain, tenderness at the site, the redness, and then generalized discomfort, fevers, malaise. So there's some other information that's been noted that we need to kind of be mindful of. Johnson & Johnson was in the news for these blood clots, and what we found is that in females, especially younger females, they were noting that Johnson & Johnson was causing people to develop an inflammatory response and subsequently develop blood clots. They had to put that vaccine on pause until they drew out some of that information and then subsequently said it was okay to continue to proceed. The incidences were far less than and comparable to blood clots in the general population. So they proceeded to continue with that. As far as other vaccine recipients, we know that the dates or the ages of these individuals was less than 50, greater than 18, and it happened within the first 2 weeks of receiving that vaccine. There was an individual that did pass away. That one individual that passed away from that did suffer from the clots, but also had a few comorbidities, meaning other medical conditions that were exacerbated secondary to that. But the benefits certainly outweighed the risks in the general population, but it's something to be mindful of. Another thing that we've been seeing in the news right now and in the media, of course, is myocarditis and pericarditis related to these messenger vaccines. The messenger RNA vaccinations can cause, there's been some reports out there that can cause some inflammation around the heart tissue or the heart tissue itself. Those people end up developing some tightness in their chest, some shortness of breath, sometimes what's called pleuritic chest pain, when you take a deep breath and you have pain in your chest area as well. This often happens after the second dose. I failed to mention, but the messenger RNA vaccines are 2 doses, while the adenovirus vector is 1 dose. So Johnson & Johnson's a single dose, the Pfizer and Moderna are 2 doses. We found that this was mostly in male individuals aged greater than 16, usually after their second dose, and it typically happens several days after receiving their second dose. Most of these individuals returned back to normal with symptomatic care. Several were hospitalized just for observation. Typically, several days after, they were able to return back to their normal function, no issues. But it's something to be mindful of, that if you start to develop those symptoms, especially if you fit into those categories, that this is a known complication that we're aware of. So what should you do if you start to experience any of those side effects I mentioned, not just the dramatic ones? One of the biggest things, of course, is most of your side effects are simple over-the-counter, ibuprofen or acetaminophen. That usually alleviates a majority of your symptoms right off the bat. Upper arm discomfort, you can always use like an ice pack at the site of the injection. We ask people not to pre-medicate prior to getting their vaccine. I know a lot of individuals used to take medications prior, a Benadryl, perhaps steroids, perhaps, or even ibuprofen or acetaminophen. And we found that it may interfere with antibody production. And so you really want your body to experience a robust response so that you get adequate antibody responses. And so we would ask you not to do that. Certain individuals, of course, may experience severe side effects who are vaccinated. And those people we do monitor through a national database, and it tracks and monitors all of these adverse effects. So you could log on to that and, of course, mention your discomfort. It's really not regulated, so anybody can go onto that site and discuss their symptoms. But what they do look for is patterns. So if you fit a pattern that's been provided across the board, we certainly look into that as well. A question that we were all asked, I think all of us in the panel, and I'm sure some of you in the audience are asked, is why be vaccinated? Once you're vaccinated, this virus is no longer novel to you, meaning your body is already used to what potentially could occur, and you've already developed antibodies to these. And so some of the long-term effects that you see of patients with COVID-19, it's something known as long haul syndrome, prolonged fatigue, shortness of breath, prolonged coughing, joint pains, depression. All of these things can be prevented by the vaccine itself. It's an important way to prevent acute infections, of course, as well. We know that the efficacy of these vaccines are phenomenal. Messenger RNA vaccines efficacy was first reported in the 94 to 95 percentile, meaning 94 to 95% of individuals wouldn't even contract the illness. We know now the real world data is a little bit less. It's roughly around 90, 92%, which is still an excellent efficacy of this vaccine. And so it certainly prevents hospitalization and severity of illness. So if you got ill, perhaps even if you had the vaccine, you wouldn't be sick enough to be hospitalized, which is an excellent thing to be able to have. Once a large proportion of your community becomes vaccinated, it's really difficult to spread the disease to other people. And it's something known as herd immunity. And as long as you have a larger amount of people in your area to be vaccinated, you can protect those people that can't, especially younger children who we aren't able to vaccinate just yet, as data is still coming out, as well as older individuals that have allergies or risk factors who couldn't do that as well. So it reduces that spread and certainly can help stop the pandemic. And then as far as when are you fully vaccinated, typically fully vaccinated is 2 weeks or more after your second dose if you're receiving the messenger RNA vaccines, or 2 weeks or more after receiving your single dose of the Johnson & Johnson vaccine. So are there any long-term effects? Unfortunately, we're still continuing to monitor long-term safety data. We know that these vaccines were developed very early on into the pandemic, and we have a robust amount of information. There's significant amount of data throughout the world, not just the United States, that have been studying these vaccines. And so all of that information we're gathering. What we know now is that there's these short-term side effects we've kind of mapped out for you through this presentation. Long-term side effects don't seem to be like many, but again, that's rolling information. We know that there've been millions of doses of each one of these vaccines administered already and has deemed through the world to be safe. So a question that we often all get is, I've already had COVID-19. Do I need to be vaccinated? The answer to that is yes. We know that natural immunity wanes roughly after 90 days of being infected. It really depends on the severity of your illness. So if you were severely ill, perhaps hospitalized, requiring supplemental oxygen, your antibodies may have been a little bit more robust and your immunity may last a little longer. But for the general population that developed COVID-19 but subsequently didn't have to be hospitalized, typically your antibodies wane 90 days later, and you can potentially get reinfected. We know that that reinfection can sometimes be far greater than your initial infection, which could land you back into the hospital. We also know that the vaccines protects substantially against these variants, and so it has additional benefit with these new strains that are coming into our community. Will the vaccine make me as sick with COVID-19? The answer to that is no. I mentioned this earlier. We're not injecting a live virus with this vaccine. The vaccine is really a particle that tells your cells to develop what's called a spike protein, and you develop these antibodies to that. Your immune response will recognize these spike proteins, build these antibodies, and help patrol your system so that you don't have, if you perhaps were in contact with someone with COVID-19, that it would already block that from infecting your cells. Typically, it takes your body several weeks, as I mentioned earlier, 2 weeks or so after your second dose of, if it's the messenger RNA, or 2 weeks after your single dose, to really be fully immunized. A question that we've gotten, I guess, throughout this pandemic, especially with the vaccines, was with pregnancy. I'll preface this study or this slide by saying there have been a lot of campaigning against vaccination, especially by, unfortunately, misinformation through the internet and social media. There's no concern if you're pregnant or want to have children and you're a female as far as this vaccine doing any issues with that. There was a very poorly designed study, actually was completely wrong, and it was circulated through social media discussing this. We know that those people who are trying to be pregnant should get the vaccine. We know that people who are pregnant suffer far more once and if they're infected. And so the benefits certainly of COVID-19 vaccination is there. We know that it does not affect any kind of placental growth, any development, or even fertility issues. In that previous misunderstood or misrecognized study, there was concern that your body would develop antibodies against placenta and fetus. That's actually far incorrect, and that's not true. So I want to take that opportunity to bust that myth. This is something that's been more in the media now, and does COVID-19 cause you to be magnetic? The answer to that, of course, is no. There's no component in there that can create an electromagnetic field. There's no iron, nickel, cobalt, lithium, any of those rare earths that would allow you to develop that. Unfortunately, this was sensationalized, I think, in the media, but it's quickly been debunked. And so, no, it does not do that. Will it alter my DNA? And I kind of have gone into this a little bit, but really to drive this point home, The messenger RNA or the adenovirus vectors do not inject material into your DNA. It does not inject material into your nucleus of the cells. It really is in the outer layer of the cell. That outer layer of the cell opens up, reads that blueprint, and decides to build these spike proteins. That blueprint quickly dissolves out, and your cell is left with spike proteins. That cell lives its half-life of however long that cell is to live. Typically, it's 90 days or so, or it may get dissolved up by the spleen and it dissipates. But what lasts is those antibodies, typically similar antibodies as if you were infected with COVID before. Another one is COVID-19's vaccination authorized for the United States release any of their components? The answer is vaccine shedding is not there. And so discharging vaccine components in or outside of the body does not occur. We've seen this occur when people are concerned about components in their body tissues, for instance, or in their organs. That does not occur. This, again, it occurs only in the cell, and then the cells dissipate. So it doesn't really saturate different organs like your kidneys or your heart or anything like that. Can someone who received the vaccine affect their menstrual cycle? The answer to that is no. If you're around somebody and you're having a menstrual cycle and people have the vaccine, it will not. This has been something that's in circulating social media right now, that your menstrual cycle can be affected by being near someone that's had COVID-19. This certainly cannot. A lot of different things can affect the menstrual cycle, including stress, hormones, schedule changes, problems with sleeping, changes in diet and exercise. But being around anybody that's vaccinated is certainly not one of those. So some of the resources that we've used, of course, to make this presentation, it's under the EUA, so Emergency Use Authorizations. Those are available at the FDA's website on COVID-19. It's available in multiple languages, of course. So if you have friends that have difficulty with English, certainly spread that information in different languages. It's very useful for us. We can talk a little bit more about EUAs versus FDA approval if those questions arise. Some of the things, once you're vaccinated, even if you are vaccinated, it's just examples of ways to really participate. This is a quick kind of slide to help reinforce why vaccination is really important to resume back to normalcy. Of course, outdoor activities is great. Doing any type of outdoor activity with vaccinated or unvaccinated people should be okay. If you're vaccinated and you choose to do small outdoor gatherings with unvaccinated people, although you're in areas that you could transmit or have high rates of transmission, you certainly should wear a mask, of course, if you're unvaccinated. If you're vaccinated, you don't have to wear a mask. Dining at an outdoor restaurant with multiple households, you don't have to wear a mask if you're vaccinated. Whereas if you're less vaccinated, or if you're not vaccinated, excuse me, it's a less safe activity and you should wear a mask in those circumstances. And of course, attending a crowded outdoor event like a live performance, parade, or sports activity, if you've been vaccinated, you don't have to wear a mask in those circumstances. You certainly should wear a mask if you're unvaccinated because of the risk of spread there. As far as indoor activities are concerned, if you're vaccinated, as you see, the green lights on that side, you really go down the list of multiple indoor activities, including singing in choirs. For instance, that was a big thing in the media as far as people spreading and super spreaders, going to get your hair done, shopping in a museum, for instance, indoor movie theaters, sporting events as well, exercise classes, or an indoor restaurant or bar. For those people who are not vaccinated, I would highly recommend to wear a mask in a lot of those settings. Unfortunately, the circulation and ventilation in those areas may not be up to speed. And so you have to be very cautious as far as being around someone that potentially could be a super spreader and you could get the illness. And so what do you do if you believe you or someone you know, or you've been in contact with someone that has COVID-19? You certainly want to self-isolate and seek medical attention right away. there's a quick slide from the CDC, really breaks down what you should do. You should stay home. I know a lot of people, especially when you're going to school, you really want to push through and try to make a good impression. But the best thing to do is stay home until you've sought appropriate attention, especially if you're not vaccinated, because you may have had exposure. You want to continue to monitor your symptoms while you're home, stay rested, stay well hydrated. Certainly reach out to your healthcare providers so that they can be in touch with you and guide you accordingly. If you start to notice any kind of worsening or discomfort, you want to certainly reach out to higher levels of care, meaning like 911 or dispatch to an emergency service. If you start to cough or have sneezes, to certainly cover those. Wash your hands as often as you can, and then stay away from other people in your household. If you have to be around other people, to wear a mask so that you don't spread any of those particles elsewhere. Try to avoid sharing personal items, especially drinks, household beddings, dishes, sheets, and of course to clean all of your surfaces as well as you can. And that pretty much concludes our slides. I'm sure there's a bunch of questions, but.
Yes. Well, thank you so much for the information, Dr. Trivedi, a really comprehensive layout of information on COVID-19, but also the vaccination, and covered a lot of the major questions that have been in our community about the vaccine. We're going to open the Q&A area to gather some questions, but in the meantime, I want to ask our panel a few questions to start with. So, given all the conversations about the vaccine and what we know about COVID-19 at this juncture, what are some ways that we can, some practical ways of having conversations with members of our community and also our families and others about why getting vaccinated is helpful? And I open that up to folks.
Okay. Hi, I don't mind speaking about that. I think the most important thing is just, creating a safe space to have that dialogue. And what I mean by that is sometimes people are not getting vaccinated because they may be scared. Maybe it's fear of the unknown, or they don't feel like they have enough information. And to just listen to them and not be, judgmental. I know as public health practitioners, we can always, go in, but you need to do it because of X, Y, and Z. And sometimes, you need to just listen and see like what the reasons are why someone may not be getting vaccinated. And sometimes it's just, like you said, like there's a lot of these myths that are out there. And so just have the conversation, like what are reasons why you are not considering it? And it may be because of some of these myths. They may think that they don't trust the vaccine or something is in it. And just have that conversation of just answering those questions and making sure that the individuals they can make an educated decision. Because a lot of times they're just stuck because there's so much information on the internet and a lot of it is not correct. So by giving them the information, I think also too, what has helped me with my family and friends is sharing my experience of getting the vaccine. When I got my vaccine shots, I got Moderna, I did videos and I did videos when I got the shot. And then even after I had, some side effects after the second shot, I did videos there too. So I was transparent, and a lot of people said, they trusted me and they were thankful that I was transparent about the whole process, and it encouraged them to get vaccinated as well. So I say just try to understand if they haven't gotten vaccinated or they're not willing to try to get more information as to why and help them to get the information.
The only thing I would add to what Dr. Shine just said is that she mentioned trust, and trust is a big deal for the community that is not getting vaccinated. And I personally, had COVID as well as got the vaccine. And to share my experience having COVID and how sick I was and how bad I felt, I think the only person I communicated to was Dr. Trivedi. And I was texting him every day because I was afraid to come to the hospital. But it was horrible. And so sharing that experience and listening, I can't emphasize that more than what Dr. Shine said. It is you know, people have all kinds of stories that they've heard, bits and pieces of other stories. They've mixed the two together. They've mixed 3 or 4 other, you know, bits of data together, and they've come up with this big amalgamation of fiction. And so we really have to listen to understand what they don't understand. And sometimes it's simple, and sometimes it's patience. And so, like, the people I know that I feel strongly about not getting the vaccine, I don't hammer it home every time I see them, but I nudge from time to time to let them know that I'm still concerned about them. I'm still concerned about their well-being, and just worried about, you know, their ability to, if they're not sick themselves, how they could affect their family members who may be a little bit more vulnerable than they are. So that's the only thing I would add. But
how do we help so there's a lot of information that's out there. How do we help our community members isolate and identify what information is most pertinent and clear and current and accurate about the vaccine, so that they're not bombarded with misinformation?
Well, I would encourage people to talk to their healthcare provider. I mean, their healthcare provider can, if they have a trusted relationship with their healthcare provider can help them with some of the questions. And if they don't have a healthcare provider, maybe this is a good time to have one. You know, so many students and people in our community are healthy, but it's the people that they're around also that we're concerned about, that I know everyone that's on this Zoom call is also concerned about. So talking to a healthcare professional would be a good first step, not maybe the only, and I'm sure the other panelists have other ideas.
Yeah, I would just add to that in terms of collaboration. So yes, the healthcare provider's spot on, but for individuals who may not have access to healthcare or have a healthcare provider, or they may not be accessing even an FQHC, which is the safety net, as we all know, but just by, like, you know, local health departments having collaborative relationships with faith-based organizations, schools, and I'm sure I'm missing a whole bunch of other different types of organizations, but by having joint panels such as this and go into those particular communities or trusted individuals, because even though we say, yes, go to New Jersey Department of Health website, go to your county local health department website, some individuals don't trust government. And it's been a challenge with the health department. But if the health department is maybe teaming up with a church who those residents do trust, then you have a better chance of hearing the same. It could be the same message, but the messenger is also key in that message.
yeah, I would agree with that. I think that creating little pockets of safe spaces for people to come and really be honest about what their trepidation is. And then that's why I think it's important to have this session like what we're doing today, because you have an expert in Dr. Trivedi, Dr. Shine, Sandy Festa, people who are really, really in the trenches and know what's going on, and having us as a place where you can come and get facts. And then you still have to decide for yourself where you want to go and where you want to take that. So probably after this particular session, there probably needs to be multiple little small dialogue sessions where people can really honestly talk about what's bothering them. And, you know, some of it is not necessarily related to the science, but more of my rights as an individual is being violated because you're wanting me to put this strange thing in my body, and I don't agree with that, and I have a choice because it's my body. And I've had lots of conversations in that regard as well. So I just think that in those types of situations, again, you have to listen, you have to understand where people are coming from, And you may not be the person that turns them around. It could be somebody you bring with you. It could be, whoever, it's somebody they trust. And I think it was Dr. Shine that brought up the clergy. I just, a lot of people do trust their clergy, but a lot of people trust their grandmother. I mean, sometimes I've gone through the path of, trying to get you to see how vulnerable it will be for your grandmother or your grandparent if you expose them inadvertently. So that's, that's some of the things and tactics that we can continue to use.
Well, thinking about some of the questions that have come up that we've heard of. One is around the emergency use authorization and why is getting vaccinated being advocated for when it's only been given a emergency use authorization. Can you all talk a little bit about that and the rationale around that for our audience?
Sure. So I'll briefly start. Emergency use authorization and FDA approval, usually it's a very rare circumstances that you have to require an EUA, that emergency use authorization. And typically what occurs is when you have, let's say, a novel approach, a novel drug, in this case, the vaccines, the standard process is you go through, you apply for processes to test that, you go into testing, and you finally get some robust data to test it, and then you go into production. Once you go into production, you can only go into production once it's approved. In an EUA, you're funded and granted approval to produce while you're testing, so that in the chance that it is, let's say, efficacious, it works, that you have supply already ready to distribute throughout. And during this pandemic, we didn't have an opportunity to have that much time for all of that. And so what we had to do is produce these vaccines at the simultaneous time of gathering that data and research. And as that data was kind of reviewed over, and this was, again, one of the largest studies for any kind of medication, found to be efficacious against preventing the illness, they were allowed to go ahead and distribute that. And that's the important difference between the two of those things. Now, as the pandemic is still kind of revved up in certain pockets of the United States, we're still under what we would call a pandemic and a need for EUA. Slowly, as more states become, or more people become vaccinated, it'll give the FDA an opportunity to go back, continue to review that information and data, and then finally make the approval process for that. And that's kind of the difference. So I know a lot of people are concerned. It's not just a semantics thing, EUA versus FDA approval, but there's a lot of red tape that was bypassed in order to get these vaccines ready and to the public right away.
Yeah, absolutely. Absolutely. One of the questions that came up was about like some of the pre-existing conditions. So one of the questions that we got was around Epstein-Barr. Can a person get vaccinated if they have Epstein-Barr, for example?
So, there was first information if you were to have COVID-19, you had to wait 90 days, for instance, until you got vaccinated. The reason why is we knew that you would have natural immunity for at least 90 days. And it gave people who never had COVID an opportunity to jump the line in front of you to get that vaccine. Now that the vaccine is more readily available, it's very easy to walk into any clinic or any pharmacy and really request that vaccine. They've cut down that 90-day mark. Typically, if you've had COVID-19, for instance, as long as you've resolved your symptoms, you're outside of the infectivity window, which is typically 10 to 20 days, you should go ahead and get that vaccine right away. If you're acutely ill with Epstein-Barr, I would suggest not getting the vaccine until you've had resolution of your symptoms. Epstein-Barr is a tricky one just because there are people that have what's called chronic fatigue syndrome. And those people, they aren't acutely infected. It's more of a chronic kind of situation. I would go ahead and proceed with that vaccine in those circumstances.
Thank you. Yeah, really important.
Can I just add something real quickly? It's not related to the Epstein-Barr virus, but in terms of if you had COVID and when getting the vaccine, any event that you've had monoclonal therapy or convalescent plasma then that would be the time that you would have to wait 90 days after getting that treatment. So I think that's probably the only other exception to that.
Much appreciated. So we talked about I'm thinking, harkening back to the presentation that Dr. Trivedi shared with us about the importance of the community getting vaccinated. Wanted to flesh that out a little bit more in terms of, we have a large community here at Stockton. We have close to 10,000 students and probably 1,500 employees who are here. Can you talk a little bit more about why that's critically important within a community like ours? It's really like a small city in many ways.
Yeah, absolutely. You have all walks of life on the campus, and that's great. You have people, and the diversity on the campus is large. And so because of that, you have a lot of different, let's say, comorbidities. You have age groups. You have different people from different areas that have high risks of developing the different variants and spreading those strains as well. Within the walls of a campus, you certainly want to try to keep as many people protected and vaccinated as possible. Stockton's campus and footprint is so unique because it spreads across Atlantic City. It spreads across the mainland here. And because of that, you're really interacting with all sorts of different individuals. And because of that, you really want to do your best to try to maintain that protection and that immunity to protect your classmates and your teachers, as well as everybody else you interact with.
Absolutely. That's very, very helpful information. As we think about that, we want as an educational community, we want to have a robust learning environment for all of our students and for our community of educators who work with our students. And so that's of critical importance. One of the questions that came from the Q&A box was around the longevity of the effectiveness of the vaccine. Is there any new information about how long the vaccine is effective and whether a booster will be required at some point in time in the future?
Yeah, so there is information right now as far as boosters are concerned. We know that we don't know as far as how long your antibodies will last for. We know that they did a breakdown of the studies. We know at least 8 months people have shown still to have great response. We anticipate that to go out even further. Think about the booster shots not so much as a boost in your immunity or your antibody response, as it is more so as incorporating some of the variant spike proteins so that you have a greater kind of protection against some of these variants that have developed, so that there's not too many holes in your immunity. We do anticipate a booster or that type of variant kind of coverage towards the end of the fall into winter time is when the anticipation is. Of course, that's still getting tested by NIH and the FDA right now.
Yeah, lot of questions around that coming up, and this is all on our mind as we're helping transition our new students into the Stockton community as well. One of the questions that often comes up is the effectiveness between the different types of vaccines. So if one has an opportunity to choose Moderna or Pfizer or J&J, is there any significant differences in the effectiveness of either option for the vaccination?
Sure. So, what we do know about each one of those vaccines is they're all excellent in preventing severe cases of COVID-19. So none of them are inferior in that regard, that you should not end up at least being hospitalized, requiring ICU attention, a high level of care in a hospitalization with any one of those vaccines. We know that the two messenger RNA vaccines, Moderna and Pfizer, have a higher efficacy of preventing illness, meaning they prevent the spread of the virus, prevent the transmission a little better than Johnson & Johnson. They're roughly in the 90s. As I mentioned in our presentation, after real world data was gathered, it's in the lower 90s, 92, 93%. Johnson & Johnson, as far as the efficacy in that, is roughly in the high 60s, low 70s. But again, they all prevent severe illness. And the goal here is to prevent you from having to see me or any of my colleagues in the hospital. And that's really, really what these vaccines do great at.
Yeah, one of the things that we've been, and my colleagues and I, and throughout the university, we put a high emphasis on education, public health education, consistently around COVID-19. We've all had to continue to learn about this, as it's been really a moving, evolving a target in many ways. How can we continue to proactively educate our students, our families, our communities about COVID-19 moving forward?
Well, Christopher, and others, I think it's really important what you're doing, this, this panel discussion. Lots of bright people out here wanting answers. You spoke about an academic community that looks for answers. And so keeping on top of what's happening current, I think would be very helpful. And I do want to make one mention. I do know that we talked about, I brought it up about, reaching out to a primary care provider or somebody that you trust. There are mechanisms for you to be able to get access to, the health center on campus, as well as we have a primary care office, many across the street from the campus. I mean, almost a stone's throw if you're a really good pitcher. So, we're very committed to getting access to people. And that's why, I'm here, and we're here to provide that information.
I think that's, and I appreciate you mentioning it. We're certainly, fortunate and blessed to have a strong partnership with AtlantiCare, literally being next door to us here in Galloway and also in Atlantic City, and partnership with our colleagues there. And we certainly work closely with you all with our student health services. And Dr. Shine will be actually joining our team later on in July as a member, leading our student health services efforts as the Associate Director for Health Outreach, Promotion, and Education. So, there's definitely some synergy and some excitement around the continuous education of our student and our campus community around COVID-19. In the interest of time, I want any final thoughts from our panelists, any parting shots, things that you want our community to keep front of mind?
One thing that comes to mind is, if any event that you receive Moderna or Pfizer vaccine, to make sure that you get your second dose. They are both 2-dose vaccines. So for Pfizer, after 3 weeks, you want to get your second dose, and for Moderna, it's 4 weeks. So it's very important that you get both doses to be fully vaccinated. So I wanted to point that out. And it's already been reiterated that Johnson & Johnson is just a 1 dose. So just make sure you get that second dose.
Absolutely.
And I would just say, I looked at some of the questions in the chat, and a lot of them have to do with, the decision to vaccinate as a mandate versus not. And those are huge decisions that have to get made. And, I just ask each individual to think about their obligation to other individuals and the impact you have on this world, not just you and your space. So I can't say to you, you don't know me from Adam, but those are the kinds of questions that leaders have to answer and grapple with as they're making these big decisions. These are not made frivolously, and they're certainly not made without the science to back it up. We're here to talk about the science, but I would be remiss if to not say something about, what individuals have in terms of obligation to the community.
Much appreciated. Much appreciated. I think from my end, working most closely with our students, but also with certainly our community of educators here. I think it's really extremely important, and to the points that have been made already, it's some of the things that we can do to help enhance the health and safety of our community. I know when I got vaccinated back in March, and I have mixed, like many of us, I have mixed opinions in my own family about whether to get vaccinated or not. And I think that as an initial step, it was about being able to connect back with folks, with students, with my colleagues, with my family, freely. We talk a lot about the physical health impacts of COVID. The mental health impacts of being isolated are underrated. I mean, in our circles, we certainly pay a close eye on our students and also our colleagues in terms of mental health as it relates to navigating the pandemic. But I think that I would argue that the vaccination is a huge step towards mental health as well for those who have been isolated for months on end. And so I think it's prudent to get vaccinated if one feels if that's the best choice for them and being a member of the community. We're doing a number of things here at the university to support and encourage our community to get vaccinated. We have a number of raffles that are happening for our staff here on campus, also for our students. And a lot of information has been shared with them about how to be eligible for it. You have to submit your proof of vaccination for employees through our Office of Human Resources, for our students through our Office of Student Health Services. Dr. Shine, you're walking into a lot of work along with the wellness team. So we have a whole setup there for students to submit their documents for proof of vaccination. But it's really important. We want to make sure that our entire community is as safe as possible, and getting vaccinated is a huge step forward and doing that so that we can get back to the vibrant campus life experience that we all cherish and we all want to have for our community here. Any other parting shots of words?
I have one more, but I'll defer to Dr. Trivedi if he wanted to say something.
No, go for it, please.
I was just going to say, in terms of, oh my goodness, out my brain that fast. It's gone. Yeah, I was going to say about, oh my goodness, it's gone. I guess for me, it's just like you said, one of the things that you brought up was in terms of even yourself being like a little fearful, and myself. I mean, I was one of the first. I mean, we got the vaccine in December, so Christmas Eve, my Christmas gift to myself was my first vaccine. And for me, it was kind of similar, where people are like, oh my God, you're going to do it? You're going to be a guinea pig? And I'm like, look, and this is the point I was trying to make. Yes, there's a lot of questions about the long-term effects of the vaccine, which, yes, we're still trying to figure that out. But what we do know is the long-term effects of COVID itself. We know the short-term effects of COVID, which are, like Charisse mentioned, they were horrible. And thank God that she's here to talk about it. But then you have these people that are long haulers and people that have not made it. A lot of people have died. A lot of people lost loved ones. So we may be still trying to figure out the long-term effects of the vaccine, but we know what could potentially happen if we don't get it. So that's something where, all of the work that's being done and the message is basically the benefits of getting the vaccine far outweigh the risk of not getting it. So that's something to be mindful as well. And one of the things that's put into place for that is in terms of the monitoring. So from the vaccine provider, if there is an adverse effect, they report it. And even recipients of the vaccines, there's something called VSafe, and it's like a mobile app, and you just put in like what vaccine you got, when you got it. They'll send you text messages to check in to see how you're feeling, what symptoms or what side effects you may have. And let's say that if it's more than 3 days that you may be feeling, I don't know, a headache or something, you'll get a text message that says, well, that may not sound right, call your doctor or dial 911. So that is a way that they are collecting the data so that we can look to see what the long-term effects are. So I wanted to just bring that up. So if you do get your vaccine, register with VSafe to be able to track side effects.
Much appreciated. Much appreciated. Well, we're at time, but I want to just thank you all again for carving out time in your very busy schedules to share some knowledge and wisdom with our community here at Stockton about the vaccine. And for those members of our community who are watching it, we'll continue to share information. As we have via email, our website, students can certainly submit their proof of vaccination through the immunization portal on the website. Our colleagues can submit their proof of vaccination on our website as well through their account. But thank you again, and everyone stay safe. We'll continue to share information here, and again, we'll stay in conversation. Thank you again for sharing some words of wisdom with us again, though.